don't see ourselves as two countries. We see Sarnia, Lambton, and St. Clair County, Michigan as one community with a river that runs through it.
If we have disasters and we can't communicate to each other, especially with our first responders and our ambulances, that can cause a detriment to our health care.
The Canada-U.S. Enhanced Resiliency Experiment is designed to improve situational awareness and information sharing between the two countries. The first scenario is designed to test interoperability and broadband with sending paramedics in ambulances to and from both countries.
Well, to and from the hospitals, we can directly in the United States talk to our ambulances, but unfortunately any ambulances coming from Canada, we cannot talk to directly. They're on a different system, so they're like in a dead zone.
The goal is to build a network of communication, both data and potentially voice communication, that will span the border. So with this technology, we'll be able to maintain communication in the event that the patient deteriorates, there's a problem with the vehicle or the crew, or we need directions to get from one place to the other. The other advantage is from a patient care perspective. So now we'll be able to transmit live data, patient's current condition, whether it be vital signs, electrocardiograms, video conferencing, to the hospital and to the physician that's receiving the patient. So when we get there, they'll be better able to manage the patient, they'll have a lot more information and be ready for them when they get there.
We are in between the two countries. We are a speed bump in everything that happens as people are crossing the border. So with emergency managers, it's very important that we get them through as expeditiously as possible, but not hampering any security for the United States. We can do a pre-vetting for those people. During the cause for experiment exercises, we're going to run their information through the system, checking for a threat assessment. The officers will do a quick validation. Once that is done, the officers will indicate that they may proceed into the United States.
So looking back on the experiment, obviously I think it was a resounding success. There's a lot of firsts that were done. Certainly from the paramedic side, we were able to transmit cardiac 12-lead heart monitors to the hospital. We were actually able to get in touch with U.S. physicians as well as the U.S. Dispatch Center and the border authorities, and that really allowed us to communicate data and at the same time perform excellent patient care in those environments.
This is maintaining the communication and the applications as you move from one network to another. Normally roaming doesn't support that, but in this case we are maintaining that communication session as the ambulance crosses the bridge from Canada to the US and changes over to the US network. They're still maintaining all applications they have, and even the real-time applications such as video conferencing and whatnot.
What happens in a disaster? You know, that simple communication in a secure network, because we all know the regular cell signals are all going to probably crash in the middle of a major disaster, because what does everybody do? We all pull out our cell phones. So this new system, if it's successful and we can implement that technology, could greatly reduce the loss of life and you know, from our people that would be our patients and our first responders.